new technology predicts that a simple blood test can predict if a pregnant woman is at risk of giving birth prematurely. The small amounts of cell-free DNA and RNA contain the genetic code of nucleic acids from the fetus, the placenta, and the mother. These nucleic acids from the fetus will code for every aspect of the child. This allows doctors to learn information about the baby before it is born. How can this information predict the premature birth of a child? The blood test will show any genetic mutations in the DNA. By sequencing the free-floating RNA in the mother's blood, doctors can spot fluctuations in the expression of 7 genes that are associated with preterm birth. This allows the doctor to identify women likely to deliver too early. Once alerted, doctors can take measures to stave off an early birth and give the child a better chance of survival. Who discovered this technology? The prediction of the risk of preterm birth has been developed by Sheffield Teaching Hospital's NHS Foundation Trust and the University of Sheffield. The hospital contains almost 27,000 of the brightest students from over 140 countries. They discovered this new technology starting with 500 women in a clinical trial in 2017. New progress has proven their methods to work. What does this new technology change for our future? Roughly 1 in 10 babies are born prematurely. This new technology gives an 80% accuracy of which pregnancies will end in premature birth. Medications may be given to your baby to promote maturing and to stimulate normal functioning of the lungs, heart, and circulation. When you know that you're going to have a premature baby, the doctor will administer drugs such as surfactant, which is a medication used to treat respiratory distress system, IV medication to strengthen breathing and heart rate, antibiotics if an infection is present or if there's a risk of possible infection, or even diuretics to manage excess urine. Who has access to this new technology? Further research has made this technology available to most mothers. Before this prediction could be made with a simple blood test, the testing for premature babies was expensive. A blood test is very affordable and the results are quick and straightforward to benefit all expecting mothers. 2 social science theories that can be applied to this new technology is structural functionalist and cultural materialism. Structural functionalism focuses on meeting the needs of all individuals through social institutions. With the social institution being the healthcare system, hospitals are constantly trying to get better technology to best benefit everyone in all upcoming situations. The new technology of predicting premature birth is a good example of structural functionalism, as the doctors are trying to have a positive influence on both the fetuses and the mother's life in order to give them the best chance at survival. This technology also influences the mother's confidence in her pregnancy and the health of her baby. Cultural materialism explains the situation at hand, as it tries to prove that despite the way that society always changes, it all leads back to the same source of pathway. Cultural materialism has a biological aspect that tries to prove that we all come from the same thing. It has an anthropology background. The DNA testing that is used in order to determine whether a baby is going to be born prematurely or whether they will have any genetic disorders leads back to the fact that we all have the exact same DNA and we are all made up of one thing. This sort of biological technology shows that the theory stands and shows that our infrastructure is all the same, so the same could be said with society. Cultural materialism also explains any external environmental factors that are included in the reasons for a preterm birth.